Hello everyone, I welcome you to this lesson. Alright, today we want to look at electroconvulsive therapy, or using of electric shock in order to offer some kind of therapy. So we are looking at electroconvulsive therapy. Okay, so electroconvulsive therapy is a type of treatment that is used in mental health nursing for patients with depression. Okay, it's a last resort that is used in mental health for patients with depression, when they can no longer respond to the drugs that they are giving them, or maybe they have some known adverse reaction to those drugs. So electroconvulsive therapy can be resorted to. Alright, so the indications for the same electroconvulsive therapy can be depression, okay, where patient cannot respond to, is no longer responding to the drugs or has got adverse reaction, or mania. Okay, so mania, or in bipolar disorders, we find that we use electroconvulsive therapy. Okay, catatonia, in catatonia we also use electroconvulsive therapy, and also for quick relief in self-destructive behavior, or we can say we can use it in parasuicide. Okay, patients that want to kill themselves, so you may use for quick relief. Okay, so that the patients does not end up taking their lives. Alright, so in discussing electroconvulsive therapy, I've divided the lesson into three. Okay, so I've divided the lesson into three in that there is a way we need to look at in the way we treat a patient on electroconvulsive therapy. So there are certain procedures that are involved before administration. There are certain procedures that are involved during the administration of ECT, and also there are certain procedures that are cardinal and important after the procedure. Of course, electroconvulsive therapy, since we have said it's a form of treatment, and the way most nurses, or some recommendation that some nurses use when they are quoting a drug, you need to write it more like in a kind of profile. Okay, so for that the mnemonic that I use the same mnemonic as nurse. Okay, to quote whenever I'm talking about a drug, even in electroconvulsive therapy, I would still use the same mnemonic nurse to break down on the information about the electroconvulsive therapy. So the word nurse itself, when you're quoting drugs in pharmacology, you want to write a profile about the drug. Even ECT, you want to write profile. Okay, so the name is about the name of the drug that is in the nurse. N is for name of the drug. Then U is for the use of the drug. Okay, so for the use of the drug or mode of action. Okay, that one is very, very important, so that you know where the drug is really going to work from. Alright, then reactions. Okay, so R is for reactions or special reports that you as a nurse need to consider, like nursing implications. So what are some reactions that patient may suffer? Alright, then S is for side effects. Okay, so for each and every drug that you're talking about, the ECT or any other drugs, you need to talk about the side effects of the drug. And then E is for education. Okay, what education are you going to give to the patient? Alright, so that's about the nurse. Okay, as a framework for the profile for the drug that you are writing on. Okay, so if you want to write about ECT, you can even have a profile just like the same for the nurse. The name of the drug, okay, the mode of action, the reactions, okay, or special reports about the drug. Okay, then side effects, and then the education that you're supposed to give. Alright, so with that said, what we are saying is that electroconvulsive therapy has got a lot of controversies surrounding it, but it really helps a lot of patients when actually it remains the therapy. In that instance, it really helps a lot of patients. Okay, so electroconvulsive therapy is simply an introduction of electrical current to to someone's brain or someone's head, okay, within the nervous system, with the aim of stabilizing the brain chemistry, okay. That is the main aim of electroconvulsive therapy. Of course, it can be administered unilaterally or bilaterally, okay. Some of these electrodes may even be put on some kind of ailment that someone will need to wear, okay. So there are types of machines, of electroconvulsive therapy machines that are used. Otherwise, about 800 amps of electricity will be used, okay, and it will be administered at frequency of about 60 to 70 Hz, okay. So these machines may have different graduations, so you find that a lot of books are even a bit silent on the dosage of the drug, okay. So in our profile, we did not talk about necessarily the dosage, because when you write the name, you need to talk about the dosage and the frequency of the drug, okay. So now let me go into the lesson on the procedure of administering electroconvulsive therapy. So we have the pre ECT, we have the during ECT, and we have the post ECT. Okay, so when we say pre-ECT, for pre-ECT, we have not yet administered electroconvulsive therapy. So if you have not administered electroconvulsive therapy, what are some of the procedures that needs to be done? Of course, we need to get a consent, because this procedure is quite invasive. So the consent needs to be signed. Okay. Then the patient needs to be kneel per oral at least 6 hours before or a night prior to the administration of ECT. They need to be kneel by mouth. Okay, the reason is that the administration of electricity, electroconvulsive therapy, in as much as it affects the brain, it affects other systems. May also bring about reduced peristalsis. The patient may be constipated. So it affects the hormones, it affects a lot of systems, apart from helping to normalize brain chemical transmitters. So patients need to be near oral. We don't want the patient to vomit, okay, so during the same procedure. Okay, then there will be an IV line initiation, because there will be some drugs that will be administered through the IV line and for quick resuscitation. So in case there is something wrong that goes on within the procedure, you need to have an IV line for resuscitation. So you have an IV line initiated, and then you have to remove nail polish for women. Okay, 70% of people that will end up having ECT as a mode of treatment are women. So you have to remove nail polish for easy observation for cyanosis. When someone is convulsing, oxygen saturation, okay, exchange is affected, it becomes ineffective. So there may be paracyanosis that you need to observe during the procedure. Okay, so there are some pre-medication that can be given for that is muscle relaxant, and muscle relaxant can be given. This is to reduce on the amount of convulsion, okay, that may lead to fracture. So we want to minimize on the amount of the convulsion or tonic seizure that may happen during the procedure. So we have to give anesthetic, okay, muscle relaxant, and then to reduce on secretions, we also have to give a drug like atropine, okay. Atropine, this will help to dry secretions, okay. Before the procedure is done, patients should be allowed to void, okay. Should be allowed to void to prevent incontinence during the procedure. Of course, before the patient goes for this procedure, you have to do vitals, okay. The simple reason is that ECT is contraindicated. In patients with the existing heart condition or brain tumor. So it is contraindicated. So in those, so you need to take vitals to rule out hypertension and the likes. Of course, ECT can also be done in pregnant women. There are no contraindication because it does not affect their born baby. All right. So that is for pre-ECT. Now let's talk about during ECT. Okay, so during ECT, of course, you continue doing vital signs, all right, and then because of reduced oxygen exchange, you may also need to give oxygen. There are two monitorings that are needed here. You can monitor EEG, okay, brain electrical encephalography, monitoring the brain discharges. You may need to monitor that, or you also need to monitor oxygen saturation. Okay, so as the patient is convulsing, otherwise you can place the electrodes unilaterally or bilaterally as you are about to do the ECT. Okay, all right. So now we can talk about the post ECT. Post ECT, you still need to do vitals, okay, to see that everything is okay, and then you have to reorient the patients, because some of the side effects of ECT is memory loss, headache, okay, confusion, and all that. So you need to reorient the patients. They may lose the memory of whatever was happening, but after some time, the patient is going to be okay, alright? Alright, so you can also assess for the return of the gag reflex of the patient by giving the patient a meal that is 4 to 6 hours after the procedure. This will help you to confirm that the gag reflex has returned. So we're looking at electroconvulsive therapy. Okay, so in looking at electroconvulsive therapy, you can either give a profile about electroconvulsive therapy using the pre-ECT, during ECT, or post-ECT, or you can give a profile more as if you're talking about the drug use. Okay, so now we have looked at ECT, okay, electroconvulsive therapy, and we have established that actually there is a mnemonic of writing a profile about the drug, and that mnemonic is just the way the nurse itself. Okay, so now on education, patients should not drive should not drive themselves, because this procedure is done as an outpatient procedure. So the patient should not drive themselves home. They need to be assisted, okay, by someone. Okay, all right. So what we are saying is that during the pre-ECT, we have pre-meds that we are giving, like acetylcholine, which is a muscle relaxant, and they're also giving atropine to help reduce on the secretions. Okay, and ECT, they will mostly say, most documentation, that the mode of action is not necessarily clear, but what is understood is that it helps to reduce or decrease serotonin and norepinephrine, okay, as it is normalizing the brain transmitters. So that is what it is able to do. All right, so ECT is a very helpful tool or therapy for patients in depression who are failing to respond to the normal treatment that is being used. Those drugs, they have become more like resistant, so it's a very, very effective. And for patients who might have a non-adverse reaction, actually the ECT is very, very effective. Okay, so in a nutshell, this is more of like information that you need to know about ECT. All right, so electricity is introduced just for a few seconds, okay, like for 5 seconds, just for a few seconds, and it's repeated. And when introduced, it is going to cause some kind of convulsions within hypertonic convulsions within the body for about 15 minutes or 15 seconds. Okay, it's going to cause some convulsion for about 15 seconds. So yeah, that is about ECT. And then treatment is done 3 times in a week, and for the patient to respond, you need to repeat at least 6 times, and treatment can go on for about 12 to 15 times. You can continue doing ECT. Immediately you notice that the patient has started responding, you need to stop administration of ECT. You need to stop. Patients can revoke their consent at any time. That you should know, okay, because there's a consent that needs to be signed for this procedure. All right, so in case you have questions about this within this channel, please, you are free to suggest a lot of topics there that will help supplement on what we have just covered today. All right, so you can always give those comments, the topics that you would want us to cover. Please feel free to suggest within the comment section, okay? Within the comment section below, just suggest those topics so that we can help you. All right, so mostly our mission is to make medical education simplified for a lot of students that may find it a challenge, okay? So that is just our main aim, to help out the students out there, staff, those that are already in employment. We help them out understand a lot of concepts, okay, for their revision as they are doing some continuous professional development. So that is our aim, to just help improve your education by simplifying all those difficult concepts, procedures that you might have found very difficult to understand in your medical career. So thank you very much. Please remember to return to this channel for more videos that are educative in nature about health. Thank you.